fire ignites passion and creativity. Free your imagination with the slim, sleek, and beautiful new Huawei P8.
Well, joining me here, and we are in the resuscitation room over here, one of the most advanced resuscitation rooms in hospitals across the country. And Ferdi, what an amazing hospital, super high tech. What makes this particular hospital so unique from every other hospital?
We wanted to bring something else or something different to the market, to the acute healthcare industry. And we built Mediclinic Midstream on the basis of technology, infrastructure, a green facility looking after our environment and the carbon footprint, right through the facility itself and patient care. We're focusing on clinical expertise and focusing on the patient and putting the patients first.
I like what you said now, because this is like the ethos of this place. Mediclinic Midstream is about the patient first. So you focus on the patient first before anything else.
Everything's connected. The patient comes into the hospital, all the clinical data is available to all the specialists.
So you basically arrive at the hospital, you fill in those initial forms, and then if you go for blood tests or if you have to go for an MRI scan, for example, that information is available. You don't have to fill in additional forms every time you go somewhere.
That is correct. We've signed service level agreements with all our service providers.
Yeah.
So we share information between ourselves. So the patient's information gets shared between the ancillary health services, the hospital itself and the specialist themselves. What happens when a patient comes to the hospital, they sign a confidentiality clause. The moment the patient is admitted onto the admission system, it gets recognized or pulled through to the Tegra system. That's the system that we use in theatre, and that's all connected via a vendor-neutral archive. So a patient's information, the doctor will punch in his or her details, the patient information will be on the system, everything in terms of imaging, pathology, radiology, all clinical information and data will be sent to the vendor-neutral archive and accessed from there by the specialist.
That's absolutely amazing. Now tell us the scale of this hospital. I mean, what did it cost and how many beds and what can you do and what can't you do in this hospital in terms of medical procedures?
Yeah, we built a 176-bed hospital, acute care facility. We focus from pediatrics, obstetrics, general surgery, orthopedics, urology, right through to cardiology. It cost just under 600 million to build this hospital with the infrastructure, looking at the ICT infrastructure, the networks, the total converged network. So it's a little bit more expensive than a normal hospital. Because all the equipment is linked to the vendor-neutral archive and the network, everything you see in terms of technology is linked to a network. So we've got backups in our networks. We've got 2 server rooms acting as a backup for the other server room, and we back up all the information to Cape Town every day. In Mediclinic, we've got a system. If you've been admitted to a hospital and you go to a different hospital, you'll have the information available to that hospital as well, yes.
Okay. Now, the most important question that everybody asks whenever they go into any area, any public area, you can have the most high-tech facilities in the world, Ferdi, but does your hospital have Wi-Fi access for patients?
Yes, we've got fast Wi-Fi. It's cost-effective Wi-Fi. We've got 4 different types of Wi-Fi. We've got Wi-Fi for our doctors on the HC dock, the HC net for the staff members. We've got voice over IP, so we phone for free throughout the hospital. We can also say that the Wi-Fi is not a typical coffee shop Wi-Fi. You cannot connect any other service providers' Wi-Fi to the hospital, so it's a secure environment where we use our own Wi-Fi, we distribute our own Wi-Fi, and it's set per user.
Dr. Butler, I mean, this hospital is super high tech. You know, as a cardiologist, how does the technology change your job, for example?
Well, I must say, I think starting from, even information acquisition, everything is available on our internet and iPads. We also have access to all the imaging on our laptop computers in our offices. For the cath lab, we've got a state-of-the-art biplane facility with excellent imaging, which also allows us to use minimal contrast, which can be hazardous to patients. Also, radiation is reduced with the machine. So even our cath lab has got state-of-the-art technology for patient safety. Our echo machines, we've got 3 of the most high-tech echo machines available through the hospital, where we can also do 3D echocardiography. From the laboratory, I can access any lab results that for patients that's under my care. Also, my health records is on a system that I designed, and I've got access to my health records from anywhere, even from home. Furthermore, I can access all the imaging from my laptop computer from home. to review up-to-date chest x-rays that have been done with me not being in the hospital that I can review. So yeah, it makes everything very accessible and very patient care friendly.
So we're in one of the pediatric wards. As you can see, just from the floors and just from the decor in the area, you actually don't feel like you're in a hospital. But the unique part about this is that aside from the digital side and how it's connected to the main network of the hospital and doctors are able to view the records all digitally, is the actual atmosphere. I'm walking around here and you can see it's very different to the rest of the wards because there's a lot of color, there's pictures of giraffes and everything. And that's all part of the healing process of recovery when you've had an operation or you've been sick in a hospital. But for the kids, it really feels very comfortable, it feels very warm. And the greatest thing about this, and if I had to be a patient in this hospital, I'd want to check in this particular ward because the kids have got access to PlayStations. It's part of the recovery process. How cool is that? In a hospital, games? No ways. What a fascinating experience, and this is what a 600 million rand hospital looks like. But it's more than that. It's about the design of the hospital. For example, in the ICU area, it's designed in the spoke of a wheel. So the sisters inside that particular facility have access to all of the patients. And this paperless hospital, we can call it, is not completely paperless, but most of it has been digitized. But the accessibility of the documentation is what makes this Mediclinic hospital so unique here in Centurion.